have the Kaiser Permanente CEO, Bernard Tyson, right here with us at Cracking the Wellness Code, a beautiful wellness movement by India Community Center, ICC in Milpitas. Welcome, sir, to Yo India TV with me, Jasleen Khanuja. And how's your feel at this event?
Oh, it was fantastic. I think what you're doing is amazing. It ties to our strategy of not just having a focus all on our members, critically important, of course, but also our members comes from communities, and we are a part of those communities. Our workforce comes from those communities, and so it's how do we integrate everything from a holistic standpoint. And this today is the tangible example of what we're talking about.
Every time there's an opportunity for me to volunteer, I grab it.
I'm working for Kaiser for only 5 years, and knowing the fact that they give back to the community and I do the same thing, so I'm like, yes, we have the same goal.
In 2015, Kaiser Permanente invested $2 billion in our community benefit programs, such as charitable healthcare coverage, grants, donations, and research. We offered subsidized care and coverage to more than 850,000 low-income members, and we conducted more than 4,500 studies focusing on the prevention, diagnosis, and treatments for cancer, heart disease, diabetes, childhood obesity, and more. In 2015, Kaiser Permanente employees and physicians reported 70,000 hours of volunteer service.
Awesome. So, Kaiser has a typical structure. It's a mix of a profit and a non-profit consortium, which is by far the largest in the United States. A mix of the health plan, the Kaiser Foundation health plan, the hospitals, and the TPMG, the regional Permanente groups. So what is the typical advantage that Kaiser has due to this structure?
Well, all of the resources are at the same table. All of the key stakeholders are at the same table. The interest is in the well-being of our members and our communities, and there's no daylight with any of those stakeholders at the table when it comes to that. And so even in your comment about the not-for-profit and the for-profit, the for-profit is not there to maximize profit in any way, right? It is just a structure. Everybody is at the table focused on affordable, high-quality care and services as needed. And so what we have are aligned individuals all coming together that looks holistically at what are the best ways to care for our members and the communities in which they exist. And so we have the alignment of the organization, and that's why we're able to get the things done that we get done in Kaiser Permanente.
When I come to work, I realize that everybody has the same goal as I do, and that's to be the best clinical person that we can be and deliver the best care to all of our patients.
It truly is all about the member. So for my team, we have a mantra: if it's not illegal, immoral, or harmful to the patient, find a way to say yes.
Kaiser Permanente members in 5 geographic regions rated our health plans highest in satisfaction in the J.D. Power and Associates Member Satisfaction Survey. These regions represent 98% of our 10.6 million members. In 2015, Kaiser Permanente was awarded Leapfrog's inaugural Living the Vision Award for consistently demonstrating top performance on the Hospital Safety Score and Leapfrog Hospital Survey. The Centers for Medicare and Medicaid Services awarded 6 of our regions its highest 5-star rating. Kaiser Permanente is a leader in measures of patient safety and quality care. 3 of our largest regions were the top 3 ranked commercial health plans in the nation for breast cancer screening rates, out of nearly 500 plans considered. Our comprehensive diabetes care and our hypertension control care also ranked number 1.
Awesome. And you are among the top 50 influential persons in healthcare, according to Time magazine in 2018. And we love to see that. And you're also the first Afro-American to be at this highest position, this prestigious position. So what does it mean to you?
Well, I mean, I'm humbled by it. I'm honored by it. I'm also very clear that there are many others who may happen to be African American who can do what I do. And so I don't believe that I'm that special. I believe that I am fortunate. And so for me, it's about making sure the door is open, that everybody gets a chance to be the best that they can be. And fortunately, I have been allowed to continue to grow and to develop and to contribute. And there are hundreds of thousands, if not millions, who are doing the same. And so there's room for more, and I want to see that. And that is what will make a difference in this great country in which we all live. A brand really talks about who we are, right? Most companies talk about what they do. And so what we do is we provide medical care, we provide coverage, and we provide hospital services, etc. That's what we do. But who we are is that we're an organization that was built on the principles of prevention and wellness. That's who we are. We have, from day one, the concept of Kaiser Permanente has been how to, as we call it today, maximize your healthy life years. So we've always had a focus on the side of the equation of keeping people healthy. Well, Thrive says that's who we are. We want to help you to thrive. We want to help you to live your definition of happiness and liberty. And to do that, you need good health. And so Thrive is about helping you to thrive no matter what state you might be in physically and mentally.
So Kaiser is serving over 12 million members. In 2010, a Health Connect system was deployed, which is by far the largest medical record system that anyone can ever have. And a new HR Connect system is coming up. Give us some insights into that.
Well, we believe strongly in the technology. We also believe strongly in the information. And we're in the information age, and we're in the time that we're starting to see the evolution of artificial intelligence. And what's underneath all of that is good data. Data that can answer different kinds of questions. And for Kaiser Permanente, it is, as we continue to think about healthcare of the future, which obviously is taking wellness to the next level and well-being, and then figuring out what are the right interventions when someone needs medical care. The data platform becomes even more critical in the 21st century. I think the last piece is what everybody is troubled by is the affordability of care and coverage. And
Absolutely.
that is a front and center issue for Kaiser Permanente. How can we be the most affordable as possible? So the data is also important to help us to understand what are the most efficient and effective methods of treatment and preventative care and coverage. And so it all comes together as a platform for us to do the work that we need to do.
One of the things I hear from our patients is they love secure messaging.
We promote KP.org, the app. I like it the best because you have instant access to your test results, messages from doctors.
They can book appointments right from their smartphone.
Kaiser is making technology useful for everyone.
Kaiser Permanente Health Connect is the largest non-governmental electronic health record in the nation. In 2016, we were named one of the most wired healthcare companies, and our members have downloaded the Kaiser Permanente app, the mobile version of My Health Manager, more than 2 million times.
So I saw the application of robotics and some neuro suites, particularly in the Sacramento facility, and lot of new biomed devices are there to support the best of the best medical care, and Kaiser is number one on that. So anything you would like to talk in that regard?
Yeah, I mean, we're very fortunate that we have a strong financial organization that can invest in its future on behalf of the members and the communities. And what you're describing are some of those investments that we've made. The technology is advancing and it's getting better. We are very innovative, and we are the darlings to many of the tech companies because of our integrated system, because of our medical records and health information, and because of our incredibly capable physicians and care teams. So you have a combination of all the right ingredients where technology and technology companies like to ask us to, in essence, make sure that the technology is doing what is intended. And so we do that without in any way putting our members at risk. And so what you see is technology supporting our physicians and nurses and others, not eliminating them.
Yeah.
And that's a very important thing because healthcare is high tech and high touch at Kaiser Permanente.
Absolutely.
I think that Kaiser is a leader in innovation, and that is one of the reasons why I've stayed here.
I would strongly encourage anybody that has not been involved in the Kaiser system in their life to work or at least try to find a job here, because most people that come here don't want to leave.
I enjoy my patient interactions. I enjoy making a difference in people's lives. This is like my second family. I don't think I'm leaving anytime soon.
I went to the open heart surgery and it was really quite an experience. I got home after, I guess about a week or so in the hospital and everything. And I looked in the backyard of my home and I looked at the green grass. And as I describe it to this day, I tell people it was the most beautiful green I've ever seen in my life. Now, the grass was the same grass, right? But my perspective has changed. And so from that day, I have created and I practice what I call finding a beautiful moment every single day. And so every single day, I find something that stands out as a beautiful moment, and then I take a mental picture of it every day of my life. Yesterday, for example, I was doing a walkthrough of our pharmacy warehouse in Southern California. I went down there yesterday morning to see all the great work that they're doing and to see the technology and everything. And I had a gentleman who they selected to do a portion of the tour with me. He has been with Kaiser Permanente for 26 years. So when I walked up to him, he was waiting on me and he had to stand. And he was a bit nervous, and I shook his hand, and I said, I'm Bernard Tyson. He said, I know, sir. And so I said, so tell me what you do. So he was so articulate in describing his job. And the beautiful moment for me was the pride that he showed me in the work that he did, right? And so when we finished, I said to him, I said, Mr. So-and-so, I said, this is just wonderful, and I can't tell you how proud I am that you have decided to be at Kaiser Permanente for 26 years. And he looked at me and he said, can I tell you something? And I said, sure. He said, sir, in the 26 years of my life, this is absolutely the best day ever at Kaiser Permanente, that I get to tell you, the CEO of this company, what I do every day.
That's how I'm feeling right now.
And that was my beautiful moment, and this is
It was a pleasure to get all those insights from you. We look for more preventive care and keep on thriving. What's your message to all the Yo India TV viewers?
Just keep on thriving. I think I'll end it there. Thank you very much.
Thank you, sir.
All right. Hi, this is Bernard Tyson. Watch me on Yo India TV.